All right, so let's take a look at the second type of tissues out there, which are connective tissues. Connective tissues are different than epithelial tissues in that there's a lot of intercellular space, what we'll call matrix. I mean, you're going to see a lot of fibers, and certainly there aren't going to be any openings and things like that that you found with the epithelial. So connective tissue itself is exactly what it says, is connective, but there are some surprises in here, things that you wouldn't have ever considered even as tissues, let alone connective in nature. So we're going to be taking a look at those in this particular section. I wanted to start out also by mentioning something called mesenchyme. Mesenchyme is kind of a fetal tissue where it's going to be kind of these immature tissues that are going to be maturing into different levels. So they start out with little immature versions and they'll grow up and get assigned their roles due to hormone placement and so on. So connective tissues can be kind of complex. It's by far the largest group of all of these. There's connective tissue proper that these things will actually end up developing into. So don't get too lost in that terminology and that concept. We just have immature, and then it matures into the more adult versions, if you will, the connective propers in there. So let's take a look at some of those. The first classification is going to be the cartilage. Cartilage is going to be the things that line bones. They're going to be all these other things. But notice within cartilage, we also have we've got different types of cartilage in there. 3 different types there are. We have bone itself, which you wouldn't think that would fit into a connective proper, and there's blood. Okay, certainly those aren't going to be cartilage, but they're going to be things that are going to be affected in the same kind of grouping as that. So what we're looking at here is a type of cartilage called hyaline cartilage. If you look on a regular skeleton in any classroom, you're going to see kind of a yellowish cartilage. This is going to be a lot of space, what we call matrix in there. We see that the cells are found in pairs or twins, as I like to refer to them. We see those. We're going to be finding that this is going to be the more rigid part that kind of tie the ribs into the sternum. They're going to be the base of the ears. Those are the hyaline cartilage versions, a little bit more rigid in there, and that's going to be for a lot of support and shock absorption, if you will. So that's going to be part of it. Now, I notice we have kind of an artist rendition of that, and then we have the microscope slides, and vastly different. And the reason we're showing a little fetus development here is most of our bones actually are cartilage in nature first, and the bone will grow through that. Okay, so the ossification happens through that type of cartilage, what we call growth plates and so on. Lots of matrix here. We see the cells are twins, and that's what tells me I'm looking for hyaline cartilage. Now, another type of cartilage that we're going to find is called fibrocartilage. And so this is going to be different in that it has these fibers going throughout. We see that it's a little bit more nature and support in there. And so if you look on, again, the classroom skeleton, you're going to find fibrocartilage is coated in blue. So we find in between the vertebra, okay, the intervertebral discs that go on. Those fibers allow for a little bit more bending and twisting. It doesn't tear as easily and so on. Notice that my cells are not twins anymore. There's not as much matrix in there. It's more for support, and you don't hear of that tearing as often. So you'll find it in between the vertebra, as we're seeing here in red. You'll find it in the pubic symphysis. That's another place where you're going to find fibrocartilage. Now, the third type of cartilage is going to be a very special one in that we have more fibers in there, and I always refer to this as kind of a hybrid between my hyaline cartilage and my fibrocartilage, because this has cells that look like twins, okay, found in there, and we do find, they're spread out. There's going to be some matrix, but we find 2 types of fibers there. We have elastic fibers, and we have the collagen fibers. So that makes it really bendy and twisty. So like the very tips of your ears is a different kind of cartilage than the base of your ears. Even your vocal cords, they aren't cords at all. It's actually cartilage flaps that vibrate past one another. To keep from those flaps, that type of cartilage from tearing, we have elastic cartilage that's keeping in place. Very pliable, and so that explains why if you're in a smoker or in somewhere with a lot of pollution, air pollution, that kind of thing, a lot of smog, those fibers are not going to be, they're going to be more brittle. They're going to reduce the amount of vibrations. You get a lot deeper voice because of that. You lose your vocal range. So that's the cartilage version. Now, there's also other types of connective tissue like bone. And this is kind of a general overview. We'll study bone more in depth later, but it is a rigid connective tissue. It's where all of our blood comes from, and those cells, those individual cells, are called osteocytes. So osteo meaning bone, cyte meaning cell. So we had chondrocytes with cartilage we just saw. Cartilage is chondro. This is osteo. And so when we look at this even more in depth, we see that these are cartilage rich in terms of the matrix, and we see these different components. And we'll get into all these terms of canaliculi and lamella and all that. We'll get into that when we study bone. So don't worry about that for right now. Notice that the matrix of this cell is going to be more calcium rich rather than just a fluid filled space. There are fibers that keep this and make the cells so they're going to be a little bit more pliable when you think about your bones. They're not going to be as brittle as, like, say, chalk would be very brittle and shatter. These bones have a little bit of give to them, a little bit of play. They have fibers there, but certainly the matrix is going to be more solid based than a fluid based. Now, coming out of that is also another type of connective tissue called blood. Blood is actually a tissue, if you think about it, because we've got 5 different types of white blood cells. We have our red blood cells, we have our platelets, we have all of those things. And the plasma itself, that all these things that are going to be moving around in, that is considered the matrix. That's where the chemistry happens and so on. So the blood is a type of tissue that's transporting substances like nutrients, or maybe it's transporting oxygen and carbon dioxide. It's where our white blood cells come from and so on. Blood cells look like little Cheerios. These are going to be your little red blood cells here. The big old white blood cells are the ones with the nucleus. Red blood cells don't have that. Different functions in there. So you'll be able to identify the different types. And if you use an electromicrogram, you'll be able to see even other particles in there. This is where antibodies and antigens off of each of these cells and so on. So it's very complex tissue, and we'll be studying blood later on as well. Okay, so that's what we're looking for there. Now, other types of connective tissue are describing the amount of matrix and what we're seeing in terms of, cell structures and fibers and so on. So loose connective tissue is going to be falling under 3 categories: areolar, adipose, and reticular. Areolar tissue is considered a very loose connective tissue. I know I'm looking at areolar loose connective tissue because I don't see individual cells at all. We just see a lot of matrix. I see these fibers going all over the place, and that's basically what's tying your skin to your muscle itself. So it's very stretchy that way, and the older you get, the more those fibers break down. You get wrinkles, you get stretch marks, and so on. So loose areolar connective tissue doesn't look like much. We have a lot of matrix. We have those fibers going everywhere. That's what tells me what we're looking at. Again, good examples, just tying your skin to your muscles itself, kind of that underlying connective tissue. Now we see other ones. This is kind of the tissue that ties our organs to one another, and so it basically keeps them from falling over. So that's another example that we find there. Now, adipose connective tissue is a loose connective tissue. This is an artist depiction. This is actually what it looks like with the microscope. It doesn't look like a whole lot of matrix here, but it all depends on how much lipids are found within the cell. The nucleus is way off to the side, so it just looks like actually cork, but these are living cells, and it's just filled with lipids. So it's just adipose tissue. Again, that lives between kind of the muscle and the skin. We know fat tissue as adipose tissue, so examples of that. And then we get this last one. It's called loose connective tissue, but it's reticular in nature. So it's really granular. There's no fibers there or whatever. This is going to form the soft organs of like your kidney or your liver and things like that. If you've ever eaten liver, it's got that granular texture to it. And that's because of the reticular tissue itself. So not much to look at. Just has the different granules of cells. There's no fibers or whatever, but it is loose in nature. There's also the dense connective tissue. Falls under 3 categories: the reticular, the irregular, and the elastic. Or I said reticular, I'm sorry, the regular, irregular, and elastic. I'm not actually going to talk about elastic dense connective tissue because I don't want you to confuse that with elastic cartilage, okay? But there is a third type called elastic dense connective tissue. The dense connective tissue that we see here is the fibrous, and so this is going to be regular dense connective tissue because it's all wave-like, very little matrix, if any. And so these are going to be the tendons, which tie your muscles to bones, and your ligaments that are going to tie your bones to one another. So we see regular dense connective tissue. We have the collagenous fibers there that basically flow through. No real cell bodies themselves with it. Now we have dense irregular connective tissue. It looks like a lot of matrix here and so on. So you might confuse this at first with kind of more of the loose connective tissue. But if you look within these whorls, in between here, that those fibers are actually very densely packed, okay? So it's dense, irregular, they're just going in different patterns. So this is going to be the lower layer of your skin. It's not tying your skin to the actual muscle. It's actually the lower layer of your skin itself that's giving rise to the hair follicles and so on. So that's dense, irregular connective tissue. And so that's what we have for the connectives.